It is Poison Prevention Week here in the state, and the Connecticut Poison Control Center at the UConn Health Center is raising awareness about prescription painkiller abuse. And joining us now to talk more about it is Amy Hanoian Fontana, a community education specialist at the Poison Control Center, and Rich Figlewski, a man here to put a face on this problem. Good morning to you both.
Good morning.
Good morning.
Amy, kind of explain to us first and foremost why this special emphasis on prescription drugs.
Well, this year is the 50th anniversary of National Poison Prevention Week, and we've come a long way in terms of poison-proofing houses, changing packaging acts, and those types of things to protect kids. But really, we have a new public health epidemic out there, and it's abuse of prescription painkillers, prescription pain pills. And it really affects males 35 to 54. Those are the ones who are dying the most from it. It affects the whole age range, but those are the ones who are dying the most from it.
And here to put a face on this, Rich, I mean, you have quite a story to tell. In fact, you were addicted to these painkillers after a shoulder injury at work.
Yes.
So kind of what happened from there to kind of wake you up to, hey, maybe I have an addiction problem?
Well, my life fell apart. Everything that was important to me, I lost. The only thing that began to matter to me was taking my pills. I drank with my pills, and I lost sight of everything that mattered, to the point where my family had left. I had left my family actually, and lost my home. I still maintained my job, surprisingly. Took myself to a point where I just didn't want to be here anymore.
Did you ever think it could happen to you?
In retrospect, probably. I look back at it now. I always drank. Okay. I never saw drinking as a big issue for me. I grew up in the 70s, so I was around drugs a lot. But I was always able to stop. When I started taking prescription pain pills, my life just spiraled out of control.
Why come forward with your story?
Because people die every day. At the Dry Dock, the nonprofit that we started to try to help people, we see people on the brink of death or dead on a regular basis. And one point in October, in a 6-week period, we saw around 13 people die from addiction. Right now, a lot of the people that come to see us or come to visit at our place are dual addicted. Prescription pain medication, heroin are rampant in this community. We were approached by the Center for Disease Control because finally it's been acknowledged as an epidemic, and people die all the time.
You mentioned the Dry Dock. It is a nonprofit in Wallingford that you are a part of.
Right.
Do you find that people have a tough time telling their story, or maybe admitting that their problem may be worse than they're interpreting it?
Absolutely. No one wants to admit that they have a problem. I didn't. You know, I held on to what I believed I was strong enough to take care of myself without help. You know, my wife would tell me, you know, you're out of control, and I wouldn't listen.
Wow.
No matter how much, you know, I cared for her or cared for my family. I just couldn't hear. I wasn't listening. I thought I could fix it myself. And I see it all the time with people, especially, and the families that get destroyed by this stuff is extraordinary.
So what do you tell them then, maybe, to get them through and make them listen? You said yourself you didn't want to listen. What quickly could you tell
I can't
folks?
make anybody listen. I can't change anything. I can offer suggestions. The people that are there, that are on the Dry Dock, are generally people who have some experience with it, with addiction or alcoholism or whatever. So I can't make anybody do anything. All I can do is tell them my story and offer them some degree of hope that there are ways to change and there are things that we can do not to die.
So it's up to them to kind of face up to it and want to make that change, essentially.
Yeah, pretty much.
Not anybody else. Okay, Amy, I know you've got a few tips for folks, for patients who may currently be on pain medications. Let's go ahead and run through those quickly.
Sure, you got to really pay attention to your dosage. You know, don't pretend to be your own doctor. You have to pay attention to what is prescribed and take it as prescribed. And also to be very careful of interactions of different meds, meds with alcohol, meds with medical conditions. If you have a history of substance abuse, talk to your doctor about it. That's very, very important. You know, if you get your surgery and you take your prescription pain med and it's not doing what you think it would do and you're developing a tolerance to it, let's talk to the doctor. That is your first, you know, place where you can really kind of try and get a handle on what could potentially be a much bigger problem.
And of course, don't sell those medications if you are prescribed them.
Absolutely.
That's also a big problem. Okay, some good information to share with our viewers this morning. Thank you both so much for being here. Rich, thank you for sharing your story. Again, Poison Prevention Week here in Connecticut. We have a phone number on your screen for the Connecticut Poison Control Center. That number, 1-800-222-1222.